the standardized test or just instituting our healthcare relief fund, we are finding innovative ways to lessen the burden on Granite Staters. I want to start by speaking a bit about the broader economic impacts of this pandemic today. We recognize there's a lot of anxiety out there that touches almost every sector of our economy. For businesses and individuals, we're fortunate that the recently passed CARES Act is going to open up a lot of opportunity for the state to provide some relief, and we want to thank the federal delegation for ensuring its passage. We've already begun to work to develop a structure and a process for how CARES Act relief funds will be administered and dispersed to address the most critical areas of need in our state. In the coming days, I'll be reviewing our plan with the state legislative leadership, with further announcements outlining the details of how this process will work. What I can promise the people of the state is that these funds will be distributed through an open and transparent process, and that we'll watch every dollar to make sure that we maximize our opportunity to provide as much relief to the people of this state as possible. While we're awaiting further guidance from the Department of Treasury on how these funds may be dispersed, my office will be developing a ready-to-go plan to ensure that we can quickly address the economic relief quickly with transparency, metrics, and accountability. We're pushing the federal government to release these funds quickly because New Hampshire needs help now. We've made it clear that traditional Washington timelines are not going to work given the urgency of this crisis. There are two very serious additional issues that we have to turn to our attention to today. These are issues that don't just disappear just because of a public health emergency, and if anything, they actually may even be exacerbated given these circumstances. We must continue to support victims of domestic violence and our most vulnerable children. Today, I'm signing 2 emergency executive orders to provide protections and relief funds for these 2 at-risk populations. We know that calls to law enforcement reporting domestic violence are down during this pandemic. We know that reporting of child abuse is down. What is not down is the actual instances of the occurrence. These horrific acts are still occurring, and we must raise awareness to do everything we can to eliminate them. Call and report it. Everyone has a responsibility. First, I'm establishing the Emergency Protections and Relief Funds for Domestic and Sexual Violence Organizations. $600,000 in total. This emergency fund will ensure that domestic and sexual violence crisis centers have the resources needed to provide critical services to victims of domestic violence. It will begin by including funding to assist directly with victims' needs to cover groceries, rent, health products, educational materials for children. It will also create funding for hotel stays for victims, since all shelters in New Hampshire are at near capacity. It will also create funding for our crisis center operations to ensure that they can remain responsive to the needs of victims. Victims of domestic violence who are living in unsafe homes are urged to seek help from law enforcement or a domestic violence crisis center and to stay at an alternative location where they will be free from abuse. If you're concerned about an adult who may be in danger or experiencing violence, you can anonymously reach out to your local crisis center for ideas and ways to be supportive, and you can start by calling our statewide hotline. We can connect you or your closest resource at 1-800-277-5570. That's 1-800-277-5570. A second equally pressing matter is raising awareness for our vulnerable children. While calls have gone down, that does not mean that abuse has stopped, and everyone, whether you're a store clerk or the mailman, a neighbor, a relative, everyone has the responsibility of reporting child abuse. As we do each year, we have proclaimed April as the Child Abuse Prevention Month, and this month it's important to shine a light given the COVID-19 crisis. So during this state of emergency, I am authorizing over $2 million in new funding to help our vulnerable kids. We are moving all family violence prevention specialists in each office across the state from part-time to full-time so they can help DCYF staff support victims of domestic violence and their families. We're adding funding to hire new licensed drug and alcohol counselors to provide support for families with substance use disorder issues. And we're increasing the age cap from our Strength to Succeed program, which is currently at 0 to 6. We're going to be moving that from 0 to 10 years old. The Strength to Succeed program is an all-encompassing program that helps parents find peer and recovery support, educational opportunities, rapid access to treatment, and delivering of home visiting curriculum. We're also going to be providing technology support for families involved with DCYF to facilitate electronic visits as a result of the social distancing efforts across the state. And finally, a family support resiliency hotline that will help expand support and reduce stress on families will be operational this coming Monday, April 6th. While we're putting these resources out on the front lines, it's important to elevate the message to the public. Here in New Hampshire, all adults are mandated reporters. Because that's what we do here. We protect our children. We understand that in a state where community is so critical, our neighborhoods, our families, our workplaces, we take on that responsibility, all of us. We have to know the signs of abuse, tell the responsible authorities when a child needs help. The New Hampshire DCYF hotline to report abuse is 1-800-894-5533. It's staffed 24 hours, 7 days a week. And again, it's 1-800-894-5533. And you can also go to the knowandtell.org website, which is KNOWANDTELL.org, knowandtell.org, to report such situations. I'm now going to turn it over to Dr. Chan for our public health date this afternoon. Thank you, Dr. Chan.
Great, thank you, Governor. I want to give you all a brief global and New Hampshire public health update on the COVID-19 situation. So far, there are now more than 900,000 cases of COVID-19 globally. About 200,000 of those are in the United States. To date, our residents in New Hampshire, more than 6,400 residents in New Hampshire have been tested for COVID-19, and we have identified 415 people in New Hampshire with COVID-19. Now, these are just the individuals that have undergone testing and been officially diagnosed with COVID-19. And so I think it's important to recognize and remember that there are likely a number, if not many other people out there with more mild symptoms of COVID-19 who have not been tested, who could potentially have infection. And I say this to stress the point that at this point we believe COVID-19 is widespread and present in most communities throughout our state, and so people need to be taking appropriate steps to slow and prevent the spread of COVID-19 within our communities. Out of those 415 people diagnosed with COVID-19 in New Hampshire, we have identified 59, or about 15%, who have required hospitalization, and we are reporting 4 individuals who have died as a direct result or as a complication from COVID-19. Now, we are aware of additional people who are hospitalized or additional individuals who have died and are undergoing further investigation and testing for COVID-19. So these numbers are likely to increase in the coming days, certainly as COVID-19 continues to spread and increase not only in New Hampshire but around the country. There's been a lot of discussion, I know, about some of the data that we've put out on our website, specifically some of the maps we have put on our website down at the town level showing which towns have identified confirmed COVID-19 cases in their communities. I want to highlight that this map that has been posted to our website looks at the town of residence of people who have been diagnosed with COVID-19. And I want to emphasize again that there are likely many other people who have symptoms of COVID-19 who are appropriately being managed by providers at home who have not been tested. And want to stress again that we consider COVID-19 to be widespread and present in most areas of our state. And so everybody needs to take appropriate steps to prevent further spread of COVID-19 in our towns and in our communities. We talk a lot about social distancing, and that remains important. So people that do not need to go out, or if there's not an urgent need to go out, please remain at home. If someone does go out, for example, to a grocery store, to a gas station, people should maintain at least 6 feet of distance from others at all times to help minimize and slow the spread of COVID-19 within our communities. We know that it's possible to be exposed to COVID-19 through touching a contaminated surface and then touching one's eyes, nose, or mouth. And for that reason, we encourage frequent and good hand washing and hand hygiene. We encourage disinfection and cleaning of frequently touched surfaces like door handles, grocery cart handles, grocery cart baskets that other people may have recently touched. And please avoid touching one's eyes, nose, or mouth with unwashed hands. It's important for us to protect those in our communities who are most vulnerable, so people that are of an older age, people with multiple or chronic medical conditions are at increased risk of needing hospitalization and possibly even passing away from illness if they become infected with COVID-19. And so it's imperative for all of us to follow these recommendations to protect others in our community. Remember that the majority of people with COVID-19 will only have mild symptoms of illness and will not require hospitalization and will recover on their own at home. However, whether someone has symptoms or potentially may be harboring the virus but not yet have developed symptoms, these individuals are certainly capable of passing it on to other people who may be more vulnerable in our communities. And for this reason, it's important for all of us to practice social distancing within our communities and protect those who are most vulnerable. We've been asked frequently, how long is this going to go on for? And I think we can expect that this outbreak in New Hampshire and global pandemic is not going away in even the next few days or weeks. COVID-19 is going to be with us for likely many more weeks, possibly on the order of months. It's very difficult to predict how a pandemic is going to proceed. We understand the difficulties that this outbreak is causing people and families, but it's important not to become complacent in our measures around social distancing and want to support families and communities to take the appropriate steps to not only protect themselves and their families and their neighbors, but other people in our communities. So with that, let me turn things back over to the Governor. Thank you very much.
Thank you very much. You know, today we're talking about obviously the impact that this crisis is having. We talk about the lives that is being affected, the ever increasing number of positive cases that we find in this state, and we know we're going to be in this situation for at least a few more weeks, if not potentially a couple more months. It's also nice to talk about the relief efforts, and one of the biggest aspects I think of today is talking about the fact that there are indirect consequences that you don't necessarily see that aren't directly related to COVID, but then do have indirect consequences given the severity of the circumstance, the unique circumstance that we're in, and specifically around domestic violence, child abuse issues, children that are in vulnerable situations. And again, we want to make sure that those funds are there, that we're putting those resources there, those organizations that are on the front lines for the state have what they need to again implement a lot of the prevention programs we've put forth in the past couple of years. And as more of these situations arise, we'll be able to tackle them with the flexibility and hopefully the speed that Granite Staters have, I think, known to come and appreciate. I want to take another minute and just remind folks, given the tough times that we're in, we don't want to just be looking through rose-colored glasses and what we know is going to be an ever-growing problem. The next coming weeks are going to be very, very tough, to be sure. There's also a lot of great stories out there, to be honest. I found myself over the past couple of days surfing social media, which I rarely ever do, because there's amazing stories. There's amazing stories of children talking about some of the innovative things they're doing with remote learning, stories of how people are keeping themselves doing new and innovative activities at home because of the stay-at-home order, stories of just goodwill, paying it forward, doing something kind for a stranger, picking up the phone. And I just am a huge believer that it is those stories, that positivity, that collective sense of community, that goodwill, and if anything, that gratitude, I think that we all need to take a pause and recognize that there's so many folks and organizations out there to be grateful for that are doing so many good things, not just today, but even as this crisis grows. I'm a big believer that it's those messages and lessons of goodwill, those acts of goodwill that are going to keep us strong through the toughest times, which are yet to come. The next month is going to be a challenge like this state has never seen, but if we stay together, we keep kind of expressing those good stories, and I think that gives people a lot of hope and knowledge that there will be an end to this, and we will get back on our feet and be very resilient as we always have been as Granite Staters. With that, we can open up for questions from the press.
So, Governor, based on the outbreak of the coronavirus, the secret executive process now, what sort of steps is the state taking to protect populations in nursing homes?
Sure. So I'm going to defer to Dr. Chan to take that, but the question really, for those who couldn't hear, does revolve around steps that the state is taking from a lot of the institutions in institutional standpoint. Dr. Chan?
Thank you. Yeah, thank you for that question. And certainly your question highlights the fact that individuals living in long-term care facilities, assisted living facilities even, are some of our more vulnerable populations, and we want to protect them from COVID-19. There are facilities that we're currently working with, like Crotchet Mountain, around protecting not only residents but staffs in those facilities from COVID-19. We've been actively engaging with this community and individuals that run long-term care facilities to make sure that they have the appropriate processes in place and equipment that's necessary to try and protect not only staff but residents. This includes guidance that has been put out not only by New Hampshire but also federal partners like the Centers for Disease Control and Prevention around trying to restrict visitors and restrict access to long-term care facilities and nursing homes to try and prevent introduction of this virus into these communal settings, screening employees that come into work so that we don't allow potentially symptomatic or sick employees to be working and caring for more vulnerable individuals while they might be shedding the virus. So we've been actively engaging and working with facilities to roll out some of these processes to help protect the individuals living in these communities, and we will continue to do so. Certainly any facility that has identified COVID-19 in a long-term care facility, certainly if there's a cluster of illnesses, we're actively working with them to make sure that they have the appropriate infection control preventions in place, to make sure that they have the appropriate personal protective equipment so that they can protect not only their staff and employees but also the other residents that they're caring for. I think the unfortunate reality is that this virus is spread very, very easily, not only within communities, more broadly, but also within facilities where there can be close contact and close living situations. And so I think we're in the unfortunate situation where we're going to see outbreaks and clusters of illness in facilities, and we're going to do our best to work with those facilities to try and minimize the impact on residents and staff in those facilities.
Do we have any sense of how many clusters of that sort are currently infected?
Yeah, I don't have an exact number. There are a handful of facilities I'm aware of around the state where we are engaging with the staff and the local partners there to try and minimize impact. I think that when you look at the spread of this virus, we've seen this in other states around the country, that once this virus gets into a long-term care facility or an assisted living facility, it can be very difficult to control, partly because as we're finding, there can be the possibility of transmission even before somebody becomes symptomatic. And so by the time we detect this virus in a facility, many other people may already have been exposed or potentially infected. And so these are very difficult situations to control spread of the virus in. And so there's a lot of attention now, not only in New Hampshire, but nationally and in other states, around how we can best protect populations in these facilities. I was actually just on a call with the Centers for Disease Control and Prevention before coming here on this exact topic, and this is something that states all around the country are struggling with, and we're trying to come up with the best approach to protect residents and staff that work in these facilities.
Can you describe that process? So for instance, what happened in Crotchet Mountain, when the state gets involved, is it a phone call? Is it too dangerous to send personnel down there? Do they get extra people? How does that work?
Yeah, so the process, let me repeat the question. The question was, what's the process for when public health is notified of a situation at a long-term care or an assisted living facility, for example? What's the process where we support the facility to try and control an outbreak of COVID-19? And that process, I think, is very similar to what we do year-round in facilities like with flu or other respiratory outbreaks. The first step is to notify public health, and so we ask healthcare facilities to notify us if they're seeing a cluster of respiratory illnesses in particular. Certainly if there's concern for COVID-19, there should be testing that's implemented. And then we work with the facilities to make sure that they have not only the appropriate personal protective equipment, we try and get them the necessary personal protective equipment if they don't have it to protect their healthcare workers. There's guidance specifically out there for long-term care facilities around when to do testing and how to do monitoring not only of staff but of residents to monitor for symptoms, and taking the step even of everybody in the facility, all healthcare providers in the facility wearing personal protective equipment while we try and get a potential outbreak under control. And so that process is currently playing out in a number of facilities. We have the ability to either send someone on site, or there's new technology, as you're seeing in healthcare, being rolled out around telehealth visits or doing assessments of a facility's infection control capabilities more remotely, using video and other technology to try and minimize exposure of other people going into a facility where there might be a cluster of illness there.
Dr. Chan, are we still at 0 positive cases in Coos County? And can you describe why the numbers there are so low for testing in general?
Yeah, so the question is, are we still at 0 cases in Coos County, and why is that? And the answer is that yes, there have not been any cases identified yet in Coos County. As I mentioned, we're considering COVID-19 to be widespread in the majority of our communities. So the reason for there not being anybody identified in Coos County, I think, is a couple of reasons. One is that there might not be any COVID-19 in Coos County, although I think that's very unlikely. More likely, I believe that, again, most people will present with mild symptoms of COVID-19 and may not go in for testing or may not go in for healthcare visits. And then there are, in order to be tested for COVID-19, a facility needs to have the appropriate personal protective equipment, sampling supplies to swab somebody that can then be sent to a laboratory for testing, and not all outpatient practices, especially, necessarily are comfortable in the testing process. So there may be some limitation of testing capability in Coos County as well, but I don't have numbers or data on that right now.
Would you be more precise about the number of assisted living facilities and the like where there are confirmed clusters of COVID?
I don't have exact numbers. You mentioned one that we're actively engaged with, and there are a couple others in the state that I'm aware of. But this is constantly changing on a daily basis, even.
Dr. Chan, you've seen the modeling that's out there.
Yes.
The projections, we could have 350 deaths here in New Hampshire. But one highly quoted study, it's on the White House website, shows hospitalization from COVID today is 7 times more than what you said it is. So how should residents in New Hampshire take all this? Is it academic spitballing, or should residents think it really could get that tragic here?
The question was about modeling and how bad might things get. And I've looked at a number of different models, and models are you have to evaluate models sort of in the broader picture, right? Models are only as good as the assumptions underlying the models and the data that's being put into the models. And so I think the use of models is to give us some basic picture of how the pandemic, how the outbreak in New Hampshire is going to proceed, but how exactly it's going to proceed and the exact numbers we're going to see of, in terms of number of cases and hospitalizations is always very difficult to predict. What I think we can take away from the models, as well as the experience in other states and in other countries, is that there has been and continues to be a real concern that COVID-19 will put a huge stress on our healthcare system, potentially causing a number of hospitalizations and even deaths, that are above our capacity in terms of our healthcare system to respond to. That's if we took no measures or no interventions, and that's part of the reason that we took extensive community mitigation efforts, especially early on before COVID-19 was widespread in our communities, was to try and prevent that surge and that increased capacity on our healthcare systems, to try and, you've heard this now multiple times, flatten the curve, meaning lower the total number of cases, lower the burden on our healthcare system. But that these measures also have the consequence of not just lowering the peak and slowing the acceleration of the outbreak, but they also can prolong the outbreak. Right, and so when we talk about dealing with COVID-19 potentially for weeks or even months, that is based on looking at a number of different models which have shown that likely we're going to see increasing numbers of cases over the coming at least several weeks. So that we believe the peak in New Hampshire is at least several weeks away, could be longer. But then there's going to be a tail to the outbreak that can go on for a number of weeks to months longer. And so likely we're going to be having to deal with and respond to COVID-19 for a number of weeks, if not months, which is why I made the comments at the end about not becoming complacent, because it's very difficult, seeing this in my own community, in my own family. It's very difficult to remain holed up in one's home for weeks on end, especially when you're trying to homeschool children, right? It's a very difficult time, and we want to acknowledge that. But we also don't want people to become complacent and feel like they're not seeing people around them sick. They can go out in their communities. Because it's that close personal interaction which is going to help fuel the spread of COVID-19 in our communities. And I wanted to let people know that this is going to be something that we're having to deal with for at least a number more weeks, if not on the order of months. And we will certainly be providing updates as we go forward, but it's difficult to predict how this is going to proceed exactly. But a lot of these comments are coming from looking at some of the modeling numbers.
Dr. Chan, how concerned are you as a doctor about the continued availability of PPE for the frontline medical workers in New Hampshire?
Yeah, I think the concern around PPE is certainly warranted. I think all of our healthcare systems are stressed in terms of wanting to make sure they have appropriate PPE. We're not aware of any major healthcare systems that have run out of PPE right now. Again, PPE is personal protective equipment. And certainly we're obtaining additional supplies from the federal government, from the Strategic National Stockpile. Hopefully this is a situation that improves over the coming weeks. I've heard multiple reports in the media of companies around the country stepping up to produce more personal protective equipment to try and make it more available. So I hope that this is a situation that improves going forward in the future. But right now, protecting our healthcare workers and making sure that they have adequate supplies of PPE is of one of the key concerns and one of the key things that we're working on to make sure that we're protecting our employees on the front lines.
Also to the governor, I guess, we heard Dr. Chan just talking about up in Coos County, there are potentially some outpatient practices that just don't have those resources.
Yeah.
Does that make you worry at all that maybe some of that stuff needs
Yeah.
to get up there in order to discover this?
So let me. I think there's two other key variables to the other issues that Dr. Chan brought up. First, Coos County is far and away the least densely populated county in the state. You have about 30,000 people spread over a couple thousand square miles. So there are natural barriers, given the rural aspect of Coos County, where that allow not just what we've done at the state level for social distancing. They are just naturally more socially distanced, and therefore that contributes to suppressing the viral spread. Secondly, is the mere fact and impact of Boston. We know Boston is one of the largest outbreak centers in the country, and the fact that's why you see so many of these cases in Rockingham, Hillsborough, and kind of if you look at that I-93 corridor, Salem, Derry, Londonderry, Manchester, these are some of the areas that have been impacted the most. On the seacoast, you see similar issues with Stratham, Hampton, Portsmouth, Dover. These, again, are communities that will traditionally work down and commute down into Massachusetts. So, again, it's not about blaming Massachusetts or anything like that, don't misunderstand. But when you talk about community-based transmission and the opportunity for folks to track that back into our state, if they weren't traveling internationally in the first place, there's just those also two very important variables in natural dynamics. I don't misunderstand. It's not that there's not testing in Coos County. If when you look at folks that are experiencing the higher levels of symptoms, and if their providers deem it necessary to be tested, there's a variety of ways to be tested. If it's not a test being conducted in Coos County, you can go to other hospitals and facilities that can provide those tests. Again, we are sticking to the same guidance that we put out, I think, a week ago, 10 days ago, that says frontline responders, first responders and folks on the front lines, whether it be healthcare workers, police, fire, those experiencing extremely severe symptoms, those that are more vulnerable given their health impacts, if they have secondary health situations that may compound it, those are the folks that we want to make sure we're testing and focusing on first. So I think there's just a lot of variables that may contribute. I think it's a great thing that Coos has no identified cases, but as Dr. Chan realized, it would be ignorant to think that there aren't folks up there with COVID. We know that we've identified just over 400 positive cases in New Hampshire, the actual number, without a doubt, far exceeds that, right? Because there are so many folks that we're learning are asymptomatic across this country. And one of the fears that has really been discussed over the past couple of days on the national level, which I think bears a lot of validity, is the idea that this is being transmitted in by asymptomatic patients in potentially a very real way. So there's a lot of folks out there that may have it, that may experience the symptoms, and that may recover that we'll never even know about. So again, we're focusing our efforts where they really need to be to make sure that those in the most vulnerable populations are going to be cared for. And when we talk about the number of beds available, we have one of the more recent models says that we'll need somewhere in the area of 2,000 to 4,000 beds given the severity of the situation. Well, we have somewhere between 2,000 and maybe even 3,000 beds currently available with all these flex and surge centers. We're going to be there, and that's one of the most important folks for people to know in the state. We are going to have the capacity to deal with the issue. And lastly, on the PPE front, if I may, we've received now 3 shipments from FEMA. Virtually everything that was originally allocated to us in our strategic national stockpile has been received in the state. So right now, and at least over the next few weeks, we feel very comfortable where we are with PPE. What we're relying on now is the commercial market, right? We've put in these commercial orders, both the state has, hospitals have, virtually every public health facility, not public health facility, but healthcare facility in the state has made these commercial requests to buy the product as they normally do. We're hoping that those will start being received this week, next week, and in the coming weeks to allow us to have the capacity to meet the surge level. So today we're comfortable, but we just know that this surge could get big, and we're just reminding folks that are on the front lines to conserve it and be careful with it as much as they possibly can, but again, they have to be protected first and foremost.
Governor, you granted some temporary pay increases to some who work at the liquor stores. Are you considering the same consideration to other workers like first responders or people doing case management?
Well, again, if the pay increases that we provided for or within the state are state employees. So if there are first responders at the local or town or municipal level or work for private organizations, that's obviously something that they have to manage themselves. We can't force those increases. But at the state level, we've taken action where we think we need to.
Do you anticipate, as we start to climb the curve and the math becomes more readily apparent to everyone, where we're going? I know we're early in this process now, but do you anticipate sharing with the public the kind of models you're looking at or giving
Sure.
projections based on, again, when we build more sort of numbers?
Yeah.
See that? Is that something the public's going to be sure getting into?
I'm sure my staff is laughing because I'm on my whiteboard all day long, and I'm looking at the models, I'm looking at the numbers. So if you want me to pull a whiteboard out of here with Dr. Chen, I would love that. I really would, because I think that's a very good idea, because we saw the national model. I thought Dr. Birx did a great job last night on a national level, looking at the kind of high and low projections where we think we might go, the timeline looking out. Ours are a little bit different, right, because we don't have as high of an impact. In fact, we're on the lower end of the scale nationally right now in terms of our impact. That doesn't mean we're going to remain there. We hope we do. But that will our proximity to Boston, kind of where our numbers are going, how that relates to our hospitalization rate. All the states are a little bit different, but at some point I think that'd be very useful to come on out. And if people want to, we'll get Dr. Birx out, I can get my calculator out, get him on the whiteboard, he can explain it, I'll draw the pictures. And again, just getting people to really appreciate where this state is and the impacts and the difference, I think, to the point of COAS and Carroll and Grafton County, and the difference that we may see in the southern tier versus the northern tier. That also plays, if I may, into our new ability to really flex our workforce, right? So we have a lot of workforce that are out there that are going to be nurses and doctors that are on the front lines. Well, we're really transferring our credentialing. So someone that is currently working in the North Country that might not see a surge for for a month down the road, but maybe the first surge we're going to see is down in Manchester or Nashua or over in Rockingham County. We'll be able to flex those that workforce down into the areas of highest needs, and then flex them back as we see the different models develop. Not every part of the state is going to hit a surge at the exact same time, and a lot of credit to the hospitals, the healthcare community, and the folks at the state level as well, providing some flexibility, the healthcare community, looking in terms of seeing what they can do to flex their staff to make sure that we are meeting the needs of the surge wherever it might hit first.
So the people who may have family members in these assisted living facilities where COVID appeared to be prevalent, what do you have to say to those people?
Sure. I mean, what do you say to a family member who, unfortunately, you're saying, well, we have to, we've had to stop visitation to the facility. Family members that they see may become COVID positive in a facility where we know it can spread very, very rapidly. Those are incredibly tough situations. Again, the comfort we want to give folks is we're on top of it. To Adam's question earlier, we have been sending people out to these facilities to walk step by step through them. As soon as we have some positive hits in long-term care facilities, we're walking with them step by step what the procedures are, how to use PPE, how to make sure it doesn't get transmitted throughout the entire facility. There are no guarantees. We've seen a lot of very difficult situations in other parts of the country. We know it could very well sprout up here, not just in one facility, but in a variety of them. But we're going to be on top of it. We have a great team at the state level, and we're going to mitigate it as strong as we can. And again, because we're building that surge capacity in our hospitals with supplies, if folks have very severe symptoms, we're going to do everything we can to make sure that those in most need have the materials and equipment to get them through these symptoms and hopefully get on the recovering end of the virus.
I mean, should those facilities where these outbreaks have taken place, should that be, should that be publicly reported by the state?
No, I mean, no. The question is, should the facilities be publicly reported by the state? Right now, we don't. Again, there's again that idea of confidentiality in terms of positive results, overly exposing people's medical information. So again, we're providing cases on a town-by-town level. Those facilities we're working with at individual levels, and again, if they wanted to release their information, I suppose that's up to them. But that's not the role of the state to identify that at this time.
Governor Raimondo today is ordering all state parks in Rhode Island closed this Friday.
Mhm.
Is that something, talking about the social distancing, is that something you're seriously
Yeah.
considering here?
So the question is, are we seriously considering closing state parks? Not at this time. We saw a lot of crowds last week. We saw a lot of folks in the parking lot. But again, when you actually looked at what was happening on those trail systems, how those groups were gathering, or I should say not gathering, the social distancing taking place, I think a lot of folks were doing, citizens of the state were doing a very good job with their responsibility. We'll have more staff out there over the coming weeks to, again, make sure and remind folks to keep that social distancing, good trail practices, good hiking practices. Same at, Hampton Beach. We've closed Hampton Beach, and that is definitely going to remain closed in the foreseeable future. But even on the seacoast, if you see folks like walking up and down the boardwalk or something like that, that's all permissible if they're out for exercise and fresh air. The stay-at-home order is still very much in effect, and you're going to be healthier at home. We can't emphasize that enough. But during those weather events where people do want to get out and get fresh air, we're going to have staff and personnel and just encourage folks at the Granite State to take that responsibility seriously. They've been doing a great job, and as long as they can keep that up and maintain that, we'll have the flexibility to keep these operations open. With that, if you don't mind, I think we may have some questions online over the phone, so we're going to turn it over.
Governor, the next question comes from Holly Raymer of Associated Press. Holly,
Okay.
Go ahead with your question.
Hi, thank you. Could someone please give us an update on where things stand in terms of how many ventilators New Hampshire hospitals have, and clarify, is it the state that's in charge of procuring those and then distributing them to hospitals, or are individual hospitals out there, competing with hospitals around the country trying to get more?
Sure.
Is that situation?
So the question is really about how many ventilators the state has and who's really in charge of making sure that we have enough to meet the need. So I'm going to answer the second part first, if I may. The state always wants to be here as a backstop, as kind of that emergency backstop to make sure that if we can use our buying power and our leverage on a national level to get more ventilators, more respirators, be able to transfer more pieces of equipment, like some of the equipment they use with anesthesiologists right now can be transferred into similar type machines. We want to be able to provide that support in any way we can. Obviously, hospitals and those on the front lines, they've been reaching out to try to obtain their own equipment as well. So it's really an all-hands-on-deck effort in terms of obtaining the equipment. The number continues to grow in our ability to provide those type of respirator and therapeutic resources for those with severe symptoms that need ventilation and respirators is always growing. I don't know if we have an exact number. I don't know if we have an exact number right now, but again, we can, at some point, we can probably pin that down and release it. But it's not going to be pinned down in the sense that I think it's always growing and there's always going to be opportunity. We feel comfortable where we are today in terms of having an adequate supply over the next few weeks as the surge continues to grow. Again, we think we're going to be okay, but we're always pushing and hopefully keep getting more and more equipment in over the coming weeks prior to the surge.
Our next question comes from Ethan DeWitt of the Concord Monitor. Ethan, go ahead with your question.
Great. I wanted to ask again about the $1.25 billion in the CARES Act money. So I know it's early, but could you, Governor, specify what the spending process is likely to look at? Is there going to be legislative input from the legislature, and does it need approval from the legislature? What will the transparency look like? And then I would note in 2009, Governor John Lynch created the New Hampshire Office for Economic Stimulus to help disperse that money. It was an office that was in effect for 2 years. Are you considering creating a similar office to disperse this money?
Thank you, Ethan. So the question really revolves around the $1.25 billion and, frankly, other future dollars that could come into the state in terms of the type of structure that will be in place to get that money out into the relief efforts. So we're looking at a variety of different structures right now. To be honest, I have already spoken with Chris Clement, who is in charge of the original stimulus funds. Remember, this first phase of funds that are coming in are more relief funds, not stimulus. So they're different in their flexibility, they're different in their application, and frankly, the timing is very different as well, given that there wasn't an immediate need in 2009, 2010, but given the level of the crisis, the fact we have businesses closing their doors as we speak, unfortunately, we want to be able to provide those relief efforts as soon as possible, similar to what we're doing with unemployment insurance on the individual level. Making sure that comes to fruition very rapidly is of utmost importance. And again, we're really just waiting at this point on guidance from the Department of Treasury, the release of those funds, and again, we'll have a plan to move forward. So I think the structure might be similar to something that we saw, that they saw back in 2009, but it will have to be structured differently to be sure. What level we get the legislature and the executive council to be involved in, I think still remains to be seen, but there will be transparency, checks and balances, metrics and accountability through all of it. Thank you.
The next question comes from Mia Summerson of the Keene Sentinel. Mia,
Great.
go ahead with your question.
Hi, so I was wondering if you could talk a little bit about the process by which the DHHS receives positive test results. You've noticed some lag time in between when we're getting reports of positive tests and when they're reflected in the state data, so we're just wondering if we could get an explanation about that.
Great, thanks for that question. The question was about the process by which we receive positive COVID-19 test results. So recall that there are a number of laboratories now that are testing for COVID-19, not just our public health laboratories. Certainly if a test is performed at our New Hampshire Public Health Laboratories, which is co-located with us in the same building as the Division of Public Health Services, we get those results obviously when they come off the machine, and there's a process for the internal reporting of those test results from our laboratory to our Public Health Investigation Group. There are also a number of other laboratories in New Hampshire that are, and around the region, that are doing testing, including commercial laboratories. The reporting of these positive test results is similar to normal mechanisms for reporting positive test results back to us. There are results will come back to us either through secure fax from the laboratory that does the testing, but more commonly will be reported to us through what we call electronic laboratory reporting, or ELR, which majority of laboratories have the capacity, so that when a test result comes back either positive or negative, we get messaged electronically of that positive or negative test result, and it comes into our public health agency for us to investigate, certainly if it's positive. Thank you.
The next question comes from Nancy West of InDepth. Nancy, go
Hi,
ahead.
Nancy West. Oh, thank you. I'd like to find out a little bit more about the fourth person that the state is now reporting has died. Could you get a little bit more information about that person? And I was a little unclear about how many people have been tested after they've died, but the results haven't been confirmed yet.
So the question is asking for more information on the fourth individual that has passed away, and we don't release much personal details, and in fact I don't have many personal details on that individual. What I can say is that they are an adult, and I don't have a lot of other information on one specific individual at this time.
The next question is from Rick Green with
Hi, thank you. Can you give taxpayers any idea on how bad March was for state finances and what steps will be taken to make up for the ultimate shortfall aside from federal assistance?
So the question revolves around, I think, revenues and the tax shortfalls that that we're seeing in March and likely to come in the future, and what steps we'll be taking. We haven't seen final numbers by any means. It's just April 1st. I think we'll have March numbers in the next few days, but I have no doubt it'll be a large. There'll be a large gap in terms of what was originally planned to what we see today, not just at the state level, but you're going to find that in everything from town taxes coming up. We are looking to. We haven't finalized it yet, but the possibility of allowing towns to implement an interest and penalty tax holiday for property taxpayers. If towns want to go that route, that isn't official yet, but those are the types of relief efforts that we're looking at in the short run. There will undoubtedly have to be pretty severe budget cuts here within the state. And again, our budget director and our team are kind of reviewing those numbers, working with department heads. We've already put in place the idea that there's a large variety of positions throughout the state that are not filled right now, and frankly we have frozen. That will allow us to put emphasis on areas of the most need, similar to today. DCYF, we're putting forth funds and making sure that we're attacking some of the more critical issues of the state. Corrections, for one, frontline workers, nurses, things of that nature. We want to make sure that we're there for those organizations at the state level, at least, that are going to need the most help and resources. But in short, we're going to have to go through some pretty tough budget cuts, without a doubt, pretty severe. We don't know exactly how much, and March won't be the only dictator. I think April, May, and June are going to be quite heavy. If you're in the tourism industry, if you're in the restaurant industry, if you're in the hospitality industry, the meals and rooms tax is undoubtedly going to be far lower than what was anticipated. So it's going to be a kind of a tough situation, but we have to respond quickly and we have to respond decisively. We have to make those cuts so that, again, people have an expectation of where we're going to go at the state level. These funds, these $1.25 billion, the initial funds right now, do not cover revenue shortfalls at the state or municipal level. They do not cover that. It provides COVID relief, which is great, but not revenue shortfall relief. So again, it's about really tightening the belt and finding as many opportunities to use the federal funds to either supplant or invest in the programs that directly relate to COVID and the issues are surrounding the COVID crisis.
The next question comes from Michael Graham of the New Hampshire Journal. Michael, go ahead.
Governor, you're talking about the density lack thereof up in Coles County. Well, if you're sitting in New York City right now, New Hampshire's looking pretty undense, and both Rhode Island and Vermont have issued mandatory shelter-in-place orders or self-quarantine orders for people coming from out of state, as opposed to making the suggestion as you have. Do you believe that you have the power to order out-of-staters into self-quarantine? If so, why haven't you used it? Most of the days, the people who are year-round residents of Lake Region and other places, where they're worried that out-of-staters could overwhelm their already precarious healthcare system locally.
Great. So the question really revolves around out-of-staters coming in and the concept of asking them to self-quarantine for those who are here for an extended stay, whether in the southern or the northern tier. And it's a very good question. It's an issue that we are definitely seeing. A lot of folks from out of state are coming. If they're visiting for the short term, that's fine. We're trying to remind them to use good physical and social distancing practices. If they are going to be staying for the long term, whether it be at a second home or whatever it might be, we are asking them to self-quarantine for 14 days. The secondary question was, do I have the power to enforce that? Yes, we absolutely do, if necessary, given that we can use an enforcement action. We obviously don't want to and haven't really had to do that yet, thank goodness. What we're finding is that folks are taking that responsibility very seriously, at least in the short term, and we're going to keep reminding them and not just encouraging them, but advising them that if you are coming to New Hampshire for the long term, we are asking you to self-quarantine for 14 days. And again, if we can maintain that and actually get the success rate with that we seem to have been having so far, we won't be pushed into a situation where we have to go into an enforcement action. This is still the live free or die state, and enforcement actions are the absolute kind of that last action and the last lever to pull, and hopefully we don't get there.
The next question is from Howard Alschuler of Portsmouth Herald Seacoast Online.
Sure.
Howard, go ahead with your question.
Thank you, Governor. Can you give us a little more about the thinking behind the additional funds for domestic violence agencies and for protecting children? What were the statistics you were seeing or the reports that you were hearing that led you to take this action?
Sure. So the question really revolves around what statistics or reports were we seeing that drove us to take the actions around our new domestic violence fund, as well as the child abuse prevention resources that we're putting on the table today. Again, when you're talking about the Emergency Protection Relief Fund for domestic and sexual violence, we're looking at an initial $600,000 as requested by the Coalition for Domestic and Sexual Violence. And again, those go to everything from direct support for victims in need, finding other alternative places of stay for some of those victims. It's interesting because the data that we're using to make these judgments is actually a lack of reporting. The fact that the number of calls and reports have gone down by about half for both domestic violence, for incidents of child abuse. But we just know inherently, unfortunately, that it is not to be expected that the actual cases of abuse would be cut in half, which tells us that we have to have stronger efforts, whether financially or through programmatic methods, to make sure that we're instituting all these new prevention programs that we created just in the past couple of years. We want to put them into high gear. We want to put those resources out there, especially at the individual level with a lot of these organizations that connect with families and individuals and children on a one-to-one basis. We want to make sure they have everything they need, not just to spread a good message, but to be very proactive with these families. The $2 million that we're also putting in for some of our DCYF initiatives. Again, the family violence prevention specialists, moving them from part-time to full-time, adding new employees in the LADACs, the licensed drug and alcohol counselors, and then again the Strength to Succeed program, expanding the traditional 0 to 6-year-old range to 0 to 10-year-old to allow a lot of those programs and opportunities to be open for all of these kids. We think that that's just the initial first steps. If we have to take more steps, we absolutely will. Protecting victims of sexual and domestic violence, protecting these vulnerable children is the utmost importance to the state of New Hampshire. We're going to take any steps that we need. But again, as long as, unfortunately, as we see the number of calls and incidents of reporting drop, that tells us that there's definitely a gap in the system, and that's where the state has to step up and fill that gap and hopefully provide those resources.
The next question comes from Tim Camarado of Valley News.
Great.
Tim, go ahead.
Yes, thank you. Yes, Governor, can you tell us at all, I guess, if there have been any updates with the National Guard and their activities? I was wondering generally how many Guardsmen have been called up and what are they doing throughout the state?
Sure. So the question revolves around the use of the National Guard, their current activities, and any call-ups, current call-ups, and I guess even potential future call-ups. The National Guard has been an unbelievable support force. The resources that they provide, the logistics capabilities and expertise has been absolutely integral in allowing New Hampshire to be one of the most aggressive states in all of the Northeast, to creating our surge and flex centers for setting up our beds. That's one of the primary roles that they've really been focused on. If the need so arises, other states have used their National Guard for first responders, filling in for some of the first responders that might get sidelined because of quarantining or because they may be positively COVID. That could be working with police departments, fire departments, EMTs, basic medical training, wherever the need is, the National Guard can step up and fulfill it. And again, General Michaelitis and his team, General Conway and Colonel Fessenden, and all the entire team has just done an outstanding job. I know if we need truck drivers, they're going to be there. I know if we need logistics specialists, they're going to be there. If we need folks on the front lines, they're always willing to step up and really do any job that they ask of them. We've kind of enacted about 100 of them. That's a ballpark number so far to really help with a lot of the efforts on the front lines of these flex and surge centers. And again, as we need them, we'll call them up. We have to understand that those in the National Guard that might have medical expertise, most of them are already on the front lines. They're already working in hospitals or healthcare centers or whatever it might be. So you have to be careful not to pull them out of areas where they're needed and already working on the front lines of healthcare. But I'm very proud to say that so far the response has been tremendous. Their skill set has been tremendous, and we know that whatever the need might be, the National Guard is going to be there for the state of New Hampshire. Great. So I think that closes up with the over-the-phone questions. We appreciate everyone being able to participate. And again, you know, there's a lot going on. This is such an incredibly fluid situation, whether it's what's coming out of Washington, how we're preparing here, some of the on-the-ground issues, and what we're identifying today is some of those indirect real concerns that we have. Today it's about domestic and sexual violence and vulnerable children. Tomorrow will be something else, and we'll tackle that head on. We have an incredible team here within the state of New Hampshire, and just cannot thank them enough. They've been really knocking it out of the park and doing a great job. So thank you guys very much.